All right. Let's jump into it today. We're going to tackle hand arthritis.
Okay.
Like we all hear about it,
We do.
but do we really know what to do about it? I'm not sure I do.
Right.
So we've got 3 sources here to help us figure that out.
All right.
We've got Medical News Today, Very Well Health, and a bit from Arthritis Australia.
Very good sources.
Yeah, so
Yeah.
we're not messing around.
No.
We're going deep.
Absolutely.
So, no Arthritis 101 today.
Okay.
We're assuming you've at least heard of arthritis before.
Yeah.
And we're going to go way beyond just defining it. This deep dive is all about what are the takeaways for you, the listener.
Love that.
So, first things first. Medical News Today jumps into all the different types of arthritis.
Okay.
And honestly, I always thought it was just like arthritis singular.
Yeah.
Apparently.
It's a blanket term.
Oh, okay.
Yeah.
No.
Arthritis, like you
Yeah.
said, is the umbrella.
Got it.
And then there's all these.
Subcategories?
Yeah.
So like for hands?
Yeah.
What are we talking? What are the most common?
So osteoarthritis is a big one. OA,
Okay.
the classic wear and tear.
Okay.
But then you've got
Uh-huh.
like rheumatoid arthritis.
Oh, yeah.
Now
I've heard of that one.
it's a whole different beast.
How so?
It's autoimmune.
Oh.
So it's your body attacking itself.
Whoa.
Yeah,
That's intense.
it is. And you know what? While we're on the topic of things that can really mess with your hands,
Okay.
Medical News Today mentioned post-traumatic arthritis.
What is that?
So basically, any kind of significant hand injury,
Okay.
even years ago,
Okay.
could set you up for arthritis later.
Seriously?
Yeah.
So like my skateboarding accident when I was like 12?
Could be. Could come back to haunt you.
Oh, man.
Highlights how sometimes we don't think long-term when it comes to injuries,
Totally. You just think, oh, I'll heal and be fine.
Right, exactly.
But all right, let's say we do have some hand issues. How do we even know if it's like worth worrying about?
Okay, so
What are the signs?
all of our sources
Yeah.
agree on a few key things.
Okay.
Obviously, pain's a big one,
Makes sense.
especially if it's like persistent
Yeah.
and getting in the way of your everyday life,
Sure.
struggling to open jars, buttoning your shirt,
I've been there.
that kind of thing.
Yeah, it's one thing to be a little stiff,
Right,
but when it's like, I can't use my hands.
exactly, yeah.
Okay.
Then
yeah.
you've got swelling, especially with heat and redness.
Okay.
That's inflammation,
Yeah.
which can be a big part of arthritis.
Got it.
And then keep an eye on like the shape of your hands.
Oh. Oh. Yeah.
If your fingers start looking crooked or
Oh, wow.
you get weird lumps and bumps.
Okay.
Yeah, early diagnosis is really important here
Okay.
because sometimes these changes can be slowed down, even prevented with the right treatment.
You're making me look at my hands real close right now.
Good. It's good to be aware.
Yeah, I'm guessing ignoring all that is not the best strategy.
Definitely not. We tend to just blame like getting older.
Right.
But honestly,
Yeah.
constant pain and not being able to use your hands properly,
Yeah.
that's not just normal aging.
Okay. So what's the harm in like toughing it out?
Well, you're missing out on time to manage it.
Okay.
The earlier you get help, the better your chances of slowing things down, keeping your hands working well.
Okay.
Sometimes you can even prevent damage that can't be reversed.
So it's not just about pain, it's about protecting my hands long term.
Exactly.
Okay, that makes sense. But let's say we do go to the doctor. What can we expect? Is it just like a quick look?
So Medical News Today actually goes through like a whole diagnostic journey.
Oh, wow.
First, the doctor's going to want to know your whole medical history.
Okay.
All about your symptoms, any family history of arthritis,
Oh.
past injuries, that sort of thing.
So they're trying to get a full picture.
They want the whole story.
Right.
Then there's the physical exam.
Okay.
They'll check for tenderness, swelling,
Yeah.
how well you can move your hands. Got it.
And then, depending what they find,
Yeah.
they might do extra tests like x-rays, blood tests, maybe even an MRI.
Whoa. That's a lot more than I thought.
Yeah, they're really trying to figure out exactly what's going on.
Makes sense. They don't want to miss anything.
Right. The goal is to pinpoint the type of arthritis, how bad it is, and make sure it's not something else that just looks like arthritis.
Okay, so they figure out the diagnosis, and then it's like, okay, what do we do about it?
Exactly.
And that's where it gets interesting, right? Because there's got to be a bunch of different treatment options.
There's a whole spectrum of things you can do.
So it's not one size fits all.
Definitely not. It's super personalized, depends on the type of arthritis, how bad your symptoms are, your overall health.
Okay, well, I'm already feeling a little more informed and a lot less scared of the whole thing.
That's good.
But we've only just started, right? We've got to talk about what we can actually do to manage this.
Yep.
So let's get into that.
Let's do it. Welcome back. So we just talked about, like, spotting hand arthritis and what the doctor's going to do.
Yeah.
But honestly, what I really want to know
Yeah.
is what can we actually do about it?
That's the fun part.
Right. Like,
Wow.
the diagnostic stuff is, like, a little scary.
Yeah, it can be.
But now it's like,
It's
okay,
empowering.
what do we do?
Yeah.
Give me the good stuff.
All right, so let's start with something everyone can do,
Okay.
no matter if you have arthritis or not.
Okay.
Healthy weight.
Oh, okay.
Might seem basic,
Yeah.
but all three sources were really emphasizing this extra weight puts so much stress on your joints,
Really?
especially those tiny hand ones.
So it's not just about, like, fitting into my jeans.
Right.
It's literally weighing down my hands.
It all adds up.
Wow, okay.
And remember we talked about post-traumatic arthritis?
Uh-huh.
Medical news today made a good point about preventing those injuries in the first place.
Oh, like be more.
Wear the right gears
Oh, okay.
if you're doing something risky.
Okay.
And just being mindful in general of how you're using your hands, even doing everyday stuff.
So it's like
It all helps.
those airline safety videos
Yeah.
that everyone ignores.
Exactly.
But sometimes
It is the little things.
it could save you.
Yeah.
Okay. What about what we're putting into our bodies?
Oh, yeah.
Medical news today talked about an anti-inflammatory diet.
Yeah, that's a big one.
I hear that phrase all the time.
Yeah.
But what does it actually mean?
So basically,
Yeah.
it's eating foods that fight inflammation. All those colorful fruits and veggies,
Okay.
whole grains,
Mm.
healthy fats,
So the good stuff?
the good stuff. They're full of antioxidants,
Yeah.
which can help protect your joints from damage.
Okay, so less of the processed foods and sugar.
Exactly.
Basically, give your body what it actually needs.
Give it the good stuff.
Yeah, okay. But what about people with, like, a family history of arthritis?
Mm.
Like, are we just doomed?
Not at all. Genes play a part,
Yeah.
but it's not a guarantee.
Yeah.
What you do makes a difference.
Okay.
And that brings us to another big one, staying active.
Exercise.
I know.
You're not going to tell me to run a marathon, are you?
No marathons.
Okay, good.
Very well. Health and Arthritis Australia were big on this.
Yeah.
Find something you enjoy
Okay.
that keeps your joints moving.
Right.
Swimming, yoga, brisk walking,
Okay.
even just taking breaks from sitting to stretch and move your hands.
So it's more about, like,
So you keep moving.
moving in general. So gardening counts?
Counting.
Counts.
Okay, good.
And here's the thing.
Okay.
If you already have arthritis,
Yeah.
exercise is even more important.
Really?
Yeah, it helps with the pain, makes you more flexible, even boosts your mood.
So it's a win-win.
Win.
Okay.
It's sounding less like a chore and more like just a good thing to do in general.
Exactly. And another takeaway, especially from Arthritis Australia, early intervention.
Right, we talked about that.
Yeah. Don't ignore those early signs.
Okay.
Don't just blame it on age.
Got it.
The sooner you talk to your doctor,
Yeah.
the sooner you can start managing things, maybe even slow it down.
So we're talking about, like, a mindset shift.
I like that.
Not just reacting to pain,
Yeah.
but, like, protecting my hands for the future.
It's about taking charge.
Okay.
You have the power to make choices that support healthy joints.
Okay, I like it. All right, so we've covered a lot. Prevention, early intervention, and, like, actual things we can start doing right now.
There's a lot you can do.
But I feel like there's more to this toolkit, right? What about when lifestyle changes aren't enough?
Right.
Like, the sources mentioned medications. I'm
Yeah.
curious about those options.
Of course.
Yeah.
It's important to remember medication is just one piece of the puzzle,
Okay.
but it can be really helpful.
Okay.
So your doctor might suggest over-the-counter pain relievers
Sure.
first.
Like ibuprofen or something.
Yeah, ibuprofen,
The
naproxen,
usual stuff.
the usual suspects.
For, like, headaches and stuff.
Exactly,
Yeah.
especially for mild to moderate pain.
Okay. But what if that's not enough?
Then you might need something stronger, prescription strength.
Okay.
Maybe even those disease-modifying drugs,
Hmm.
especially for rheumatoid arthritis, which can be pretty aggressive.
Okay. Those sound intense.
Yeah, there's serious medications.
Are there any other options before we jump to that?
Oh, yeah, for sure.
Okay.
Very well. Health and Arthritis Australia both talked about occupational therapy.
Oh, what's that?
So basically, an
Mhm.
occupational therapist can teach you exercises to strengthen your hands,
Okay.
improve flexibility, and ways to protect your joints while you're doing everyday stuff. They can even suggest little tools and gadgets to make things easier.
So it's like having
It's like a coach.
a hand coach.
Yeah, exactly.
I like that. But I know sometimes even that isn't enough.
Right.
What about surgery?
It's usually a last resort,
Okay.
but it can really change things for some people, especially if there's serious damage or the joints are deformed.
Okay, so it really is like a whole range.
A whole spectrum of
From
options
simple stuff to...
to the big guns.
Yeah.
But I think the main takeaway here is
Yeah.
there's hope.
Okay.
It's not a hopeless situation.
Right.
There are tools to help you manage hand arthritis and still have a good quality of life.
You're right. It's not a life sentence.
Exactly.
I'm feeling much better about all this.
Good.
But I think the biggest thing for me is, like you said, knowledge is power.
Absolutely.
The more we know,
Yeah.
the better decisions we can make.
You got it.
And the better we can talk to our doctor.
Exactly.
This has been so fascinating.
It's a great topic.
I feel like we went from arthritis is inevitable to here's what you can do.
There's a lot you can do.
I'm feeling optimistic.
Me too.
I hope our listeners are too.
I hope so.
So as you all go about your day,
Yeah.
pay attention to your hands.
Good idea.
Are you gripping things too tight? Are you taking breaks?
Important.
Are you giving them some love?
They deserve it.
Okay, we'll leave you all with that to think about.
Great.
Thanks for joining us on this deep dive. We'll be back next time with another one.
See you then.
Until then, stay curious. All right, so before we took a little break, we were getting into the extra tools we can use to manage hand arthritis.
Right.
And you mentioned heat and cold therapy.
Yeah?
I'm all about natural stuff, so tell me more about that.
It's surprisingly effective
Yeah.
and easy.
Okay.
It's all about knowing when to use which one.
Okay.
So cold therapy, like an ice pack, that's your go-to for swelling.
Okay, so like during a flare-up,
Exactly.
ice it down.
Yeah, it numbs the area, constrict those blood vessels.
So it takes down the swelling.
Right. And heat,
Okay.
that's good for relaxing muscles and stiffness. So think warm baths,
Oh, yeah.
heating pads,
Okay.
even paraffin wax treatments.
Yeah. I remember reading about those in medical news today.
Yeah, they're pretty popular.
Sounds kind of fancy. But what about when those things aren't enough? Like the sources mentioned prescription medications.
Right.
I want to know more about those.
So it's important to remember medication is just one part of managing it,
Okay.
but it can definitely help.
Sure.
So your doctor might recommend, over-the-counter pain relievers first,
Okay.
like ibuprofen or naproxen,
Yeah.
especially for mild to moderate pain.
So the stuff you'd take for like a headache?
Yeah, exactly.
Okay. But what if that doesn't work?
Then you might need something stronger,
Okay.
something prescription strength.
Like what?
Well, your doctor might consider stronger NSAIDs
Okay.
or even what are called disease-modifying drugs, especially for rheumatoid arthritis, which we talked about.
Right. The more intense one.
Yeah, it can be pretty aggressive.
Okay. So those sound pretty serious.
Yeah, they're not something to take lightly.
Any other options before we jump to those?
Absolutely.
Okay.
Both very well health and arthritis. Australia talked about occupational therapy.
Occupational therapy. What's that?
So an occupational therapist can actually teach you exercises
Okay.
to strengthen your hands, make them more flexible, and also techniques to protect your joints.
So like while I'm doing everyday stuff.
Yeah, like how to hold things, how to move.
Okay.
They can even recommend tools to make things easier.
So it's
Like,
like a personal trainer.
a hand coach.
Yeah. For your hands.
Exactly.
Okay. I like that. But I know sometimes even that's not enough.
Right.
So surgery, is that always a last resort?
It usually is,
Okay.
but it can be really life-changing for some people, especially if there's a lot of damage or the joints are deformed.
So we've got like this whole range
There's a spectrum.
from super simple stuff to
Yeah, but more intense stuff.
Yeah. But the main takeaway here is there is hope.
Absolutely.
It's not a hopeless situation.
Not at all.
There's so many tools
There are.
to help us manage this and still have a good life.
And have a good quality of life, yeah.
Okay, that makes me feel a lot better.
Good.
But I think the biggest thing for me is
Yeah.
knowledge is power, like you said.
It really is.
The more we know about this,
Yeah.
the better choices we can make.
Exactly.
And the better we can talk to our doctor.
And advocate for yourself.
This has been such a fascinating deep dive.
It really has.
We went from arthritis is inevitable to here's what you can do about it.
There are things you can do.
I feel so much more optimistic now.
Me too.
And I hope our listeners do too.
I hope so.
And remember, as you go about your day,
Yeah.
pay attention to your hand.
Be mindful.
Are you gripping things too tight?
Yeah.
Are you taking breaks?
That's
Are you giving them some love?
little TLC.
All right, we'll leave you all with that to think about.
Great advice.
Thanks for joining us for this deep dive. We'll be back next time with another one.
Looking forward to it.
Until then, stay curious.